All right, so we're live. I'll do the intro. So welcome to Exercise Medicine. I think this is podcast number 7. Today we have Dr. Shahidi, who is a doctor of physical therapy and also a PhD. Our org is Exercise Medicine, and both our organization and this podcast purpose is to raise awareness about exercise nutrition as a means of maintaining health and preventing disease. We also aim to promote professional interest and development with a focus on the various careers of sports medicine. And just to be clear, the information we talk about today is for entertainment purposes only. We are not medical professionals, and as such, it is not to be misconstrued as medical advice. And so I'll start off with a few just kind of basic questions. So Dr. Shahidi, where are you from?
Well, I grew up in Palm Springs, and then I pretty much stayed there for a majority of my upbringing. And then I went up to the Bay Area. I did my undergrad degree at Berkeley. I was a chemistry major. And then for grad school, I moved to Denver to do my PT degree. So I got a doctor of physical therapy at the University of Colorado, Denver. And then I stuck around there for another 5 years to do my PhD in neurophysiology. And then after I was done there, I came back to San Diego for a postdoc fellowship in muscle physiology and have also since stuck around here. And now I'm faculty in orthopedic surgery.
So jumping back to like kind of the beginning, what you have accomplished so much in your career, and you've come so far, like doing research and everything. What type of student were you in high school? Like, did you know that you wanted to do this when you were in high school, or in the early years of like Berkeley? Or
I was very unguided. I had no idea what I was doing. So in high school, I think probably I was a pretty good student in high school. Mm-hmm. I think it was my junior year. I had my chemistry teacher was one of my favorite teachers, mainly because she was like funny and entertaining, and would like light stuff on fire in the lab and that kind of thing. So that was my main impetus for deciding that I wanted to be a chemistry major. And also I was kind of attracted to the fact that in the UC system, particularly at Berkeley, which was one of my top choices for undergrad, they had a specific college for chemistry. And so it was like its own little program, as opposed to just being part of a larger, like, biomedical sciences or something that was kind of part of a larger program. They had their own kind of little section. And from a strategic perspective, I thought maybe that would be an angle that I would take to get in. And it worked out. Yeah. So, and then once I got through things for me seemed to happen about 3 years in, my decision I was 3 years into undergrad as a chemistry major, and I was working in a lab at the time doing some undergrad research. And I liked the people that I was working with. The projects that I was working with were very cool. I was working on developing synthetic snake venoms for like as an alternative to things like Botox and whatnot.
Yeah.
So that was kind of cool. But I realized at that point that I was not really into just bench work as a primary mode of like career operations. Imagining myself sitting in a wet lab and pipetting things for the rest of my life was not something that at the time felt like it was right fit.
Yeah, it wasn't very attractive.
Right. I was still working in the lab, and then I went home for a summer in between my junior and senior year. And just to make some extra money, I worked in a chiropractor's office, and I was just filing, but the guy that worked there pretty much, he let me do the patient intakes, and he let me go into the rooms with them and kind of I did some basic like patient history, which probably I wasn't supposed to be doing at the time, but they let me. So I was doing some patient history stuff, and I found that I really enjoyed the patient interaction and that kind of like hands-on approach towards things. So when I came back for my senior year, I kind of got the idea that I wanted to do something in patient care, but I was far too late in my undergrad career to just start over and decide that I wanted to do pre-med.
Mm-hmm.
Yeah.
So and I'd always been into athletics and sports, and I had been a competitive athlete throughout the entire time that I was in college as well. So the athletic component that was incorporated with physical therapy was attractive to me, along with the patient care. And the prerequisites for me to be able to qualify for PT school were just like an extra couple of classes, as opposed to pre-med, which would have been a much more extensive process.
Mm-hmm.
So because I decided that so late in my undergrad, I kind of ended up getting into PT as a late decision. So that was kind of how it worked. I mean, it was a little bit of luck and a little bit of timing and a little bit of just kind of not knowing what I was doing until it was too late to do anything else.
So that combination of kind of like, you didn't want to be stuck at a lab bench and working in the chiropractor's office, you were interacting with people and seeing how he interacted with his patients, that kind of drove you to consider more of like a patient-oriented career path.
Definitely. Yeah.
Yeah. And then do you wish you had more time to pursue the pre-med route, or at the time, no? Happy with your decision?
Yeah, I mean, I do have to say, you know, once I had made the decision to go the PT route, I didn't really have any doubts about that. And part of that was because the more people that I talked to about medicine, the more I kind of realized that the medical part, although the academic and didactic portion of it was super interesting to me, the actual amount of time and operationalization of medicine was not quite what the right fit for my personality. In PT, one of the things that I liked about it is you get to see the same person, you know, every week or twice a week or even 3 times a week, depending on what setting you're in, over the duration of a longer period of time. Mm-hmm. Whereas in medicine, oftentimes, again, depending on the setting, you see someone and it's almost like the goal is to never see them again, because that means that you've done a good job. And that to me was a little bit less satisfying than being able to establish a longer term relationship where you really get to know somebody and you get to apply your skills over a longer period of time with a patient relationship. So that was what was attractive to me about PT, compared to a lot of the medical practices that I had at least talked to people about, or that was kind of my perception of medicine at the time.
Mm-hmm. It was less schooling too, right?
1 year less.
Yeah, not that much actually.
Oh, really? Oh, okay.
Yeah.
So did you end up taking like a gap year or anything since you decided so late that you wanted to go to PT school? Like, or did you just go straight into it after undergrad?
So in order for me to get the prerequisites that I needed, I ended up having to take an extra semester. So I graduated in 4.5 years in my undergrad. And so that gave me like a 6-month period before the next academic year. So it wasn't really a gap year. It was just that my timing was off, and I had already, the application cycle worked out that way because PT school actually started in like the end of April. So it wouldn't have worked out for me to, at least my PT school that I ended up deciding to go to. That was just how their timing worked out. So I only had like 4 months from when I graduated to when I started PT school. Whereas if I would have finished in May or June, I can't remember when it was that normal graduation happens in undergrad. It was a long time ago. Then I would have had to actually wait the full year because I wouldn't have been able to do both.
Cool. So once you got to PT school, did you feel like you were prepared for it? If like since you weren't necessarily a pre-PT major in undergrad, like was it overwhelming for you?
Not at all, actually. And I think that was probably in credit a large part, because my undergrad was very challenging, and I had a lot of, I learned a lot in my undergraduate career. And I think Berkeley was a great place for teaching that to me. And so once I got to, and also the fact that chemistry wasn't quite right for me, you know, when you're not perfectly matched to what you're interested in, you have to work all that much harder to learn it and be interested in it and like do well in it, right? So once I got to PT school, not only did I feel like it was much easier than undergraduate, but it was because I was prepared and I knew how my learning style was, and I could optimize that for myself. But I was also way more interested in the topic. So it just came so much easier to me. And it was, in my opinion, it was way less challenging. And I felt more than prepared because, I mean, I think the majority of that was just my level of interest for the topic.
Yeah.
So do you think your knowledge of chemistry in particular helped you in PT school, or is it much more just like system, like biology based, like mechanics of movement and that type of stuff?
Honestly, so I mean, if we're talking straight didactic content,
Yeah.
Chemistry was helpful because there's a lot of pharmacology that you have to learn. Even though in PT you're not prescribing medications, you still have to understand all of that information. So that was helpful. But generally speaking, this was kind of the attitude that I had about learning, and I still have this attitude about learning. And it's like you learn stuff, but you forget it. So taking in content is not necessarily the preparative part about education. It's learning how you learn to obtain information in a way that you can integrate it and apply it. And so I think that that's the part about undergrad that I applied in grad school. Not necessarily the topic matter, whether it was biology or chemistry or kinesiology or any of those specific like didactic components. It was the actual critical thinking development and process and integration that was the thing that kept me basically going and able to function better in that environment.
So how did you ended up at the University of Colorado in Denver, right? How did you choose that school? Did it like fit with your kind of like your goals, or was it more so it fit with your academics? Or
this is also another like random whatever decision in my life. So my parents met in Colorado. Okay. And I didn't really feel like I wanted to stay in California, like not because it was mainly just one of those things that I had stayed in California for my undergrad, and there were plenty of schools that I would have been happy to go to, but I wanted to kind of explore and spread my wings and do all that kind of thing. But I also didn't want to go all the way to the East Coast, because when you grow up in Southern California, it just doesn't work that way in terms of weather, location and weather preferences and whatnot. In terms of like extracurriculars and those types of things, the sports that I did I could have done anywhere. So, and I did, and I stayed competitive even through grad school. So that was less of an issue as a decision-making process for me. And so it was more just that I had this seed in my head about Colorado, and my parents loved it and they met there, and they were like, oh, cool, that sounds like a great place. And I was like, oh, maybe I should look into that. And so I applied and I got in, and I went there to interview, and I really liked it. So I had a great experience when I came to visit and did the interviews, and that basically was what sealed the deal for me.
Cool. So did you apply to any other programs, or were you pretty much set on Colorado?
No, I did the full gamut. I applied all over the place. And I'm trying to remember the schools that I got into. The ones that I remember, like my top I think my top 5 ended up being UCSF, Duke, USC, Colorado, and there was one other, I think it was like Washington or something. I can't really remember. And I ended up choosing Colorado, I think, because I remember was coming from a place, Berkeley, where there was a lot of emphasis on, we have a big name and therefore you owe us, we don't owe you anything. Colorado had a little bit of a different attitude about that. It was a lot smaller of a program, and they were a little bit more, friendly in their approach towards things.
Yeah.
Like, for example, Duke is an amazing program, but when I went there, it very much felt like they were entitled to my acceptance, as opposed to they were looking out for my best interests. And I was a little bit over that mentality coming from Berkeley as an undergrad. So I think that was just kind of like a place that I was, and my attitude and my perspectives at the time that also drove. Did I lose you?
Yeah.
Oh yeah. Oh, you're back.
Okay.
All right. So I just wanted to kind of jump back real quick. You keep saying that you're in competitive sports, and I did find on the internet, I did a little bit of searching.
Oh God.
And I found this great image of you holding like a belt as the queen of combat grappling back in 2009. What do you have to say about that for MMA? I never knew that you did MMA.
Yeah, well, I got into, I actually started I started doing judo, and I started doing that in high school. And part of that was because my dad was a judo instructor, and he kind of got me into it, and we trained together when I was younger and whatnot. And then I kind of continued doing judo throughout my undergrad. I did that competitively. And then when I went to grad school, that transitioned, because when I went to grad school, I was like, oh, well, I did the competitive thing. I just want to do this as a hobby now. And then, so I found this club that was mainly just close to my house, and it was an MMA club. And I ended up being like way better at MMA than I ever was at judo. And hence started my MMA career.
Yeah, wow.
So I did that for another, let's see, I started PT school in 2006 or something like that. So I did MMA until 2000. I think my last tournament was like 2013 or something like that. So I did it for almost another 9 years or something like that.
Oh. Crazy. Do you think that contributed to like your love of PT?
I kind of consider those two things as separate entities in terms of interest, but I do have to say that my comfort level with like physical movement, and MMA is a contact sport. You have to learn how to move people, and you have to be very comfortable touching people and having people touch you. And I think that gave me in some ways a little bit of an advantage, because I was very comfortable with that physicality component of PT. And I think that some people struggled with that. I actually remember there was one person in our class that was very uncomfortable with touching people to do a physical exam. And PT in a lot of ways is one of the more physical professions in medicine. And so she ended up dropping out because she just really didn't feel comfortable with that level of contact with people. So I think that as an example, I that wasn't even anything that I worried about at all, because I had no problem with it. If anything, I had to be careful because I had to learn to be respectful of other people's discomfort with space.
So did you ever end up having to go to PT like during your career in MMA?
Yeah, I think it was like my second year in PT school. I tore my labrum in my hip. And so I had to go to PT for a little while in that. But at that time, I was already like,
In PT school.
yeah, I was already in PT school. So of course I was asking a bunch of questions and I was like, how come you're doing it this way? And
Really love that.
I wouldn't say, I mean, I think a lot of people when they go to PT school, and this was something that I saw, because when I was doing my PhD, I also worked closely in the PT department as part of their admissions committee. So I interviewed a lot of people. I read a lot of essays for people that were incoming PT students, and like the inevitable essay is, I became interested in PT because I hurt myself doing X, Y, or Z, and I went to PT and I thought it was the coolest thing ever. And that was not my story. My story was that like chiropractor thing, and it was kind of like the strange version of like just not wanting to be in a wet lab. So I think I had a little bit of a non-traditional exposure to PT, or lack thereof, prior to applying.
So did you ever like volunteer or like work in a PT setting before you went to PT school, like as a part of application and stuff? I know a lot of schools require like volunteer hours and stuff.
Yeah, I think that was still that was a requirement for when I applied as well, and I think they still have those requirements. So I had to, at the very minimum, have my my volunteer hours in for the purposes of the application. So I worked in a couple of different settings, but primarily I worked in a like an outpatient neuro rehab unit. And they primarily worked with like stroke patients. So that was the setting that I got most of my exposure in. I didn't really have that much exposure to like outpatient orthopedics or or anything like that. It was primarily this kind of very niche field. And I did a couple of other things because you have to have your diverse little settings to apply. But the majority of my time I spent in outpatient neuro rehab.
Cool.
So like through your journey in PT school and then eventually kind of being in the admissions seat and like reading essays, do you have any advice for pre-PT students now? Like insider tips, like here's how you write your essays.
Yeah, I mean, those are always the most important things, right? So I would say from an essay perspective, I kind of mentioned the fact that I read a lot of essays that are like, I became interested in PT because I hurt myself and ended up in PT. Mm-hmm. That is a very repetitive theme that we see and we're bored by. So if you can bring a little bit more creativity into that perspective, because I mean, it's a true story for a lot of people, which doesn't mean that it should be discounted, but it just requires a little bit more effort into bringing a little bit of a perspective that might be unique to you in that story, because the story itself is not unique, and it's in fact 90% of what we read in essays. So in order for me to remember what you wrote, or for it to stick out to me, like make it something different, or make it a way to show some characteristic about you that is not just a series of adjectives and whatnot that people like to put in those essays, but something that you actually believe in and are passionate about. And that's I think one of the things that people don't realize when they're writing those essays, because they don't know what the person is reading over and over again over 200 applications, and it gets really repetitive. So trying to get something unique in there is probably a good way to start. Make sure when you get your letters of recommendation that you are that you are being intentional about the people that you're asking. It's way better to get a letter of recommendation from someone who may not necessarily be in the field, that gives you a very good and personal recommendation, as compared to someone who might have like a bigger name or be exactly in the area that you want to be in, but gives you a little bit more of a bland recommendation. I mean, I'll give you an example. There was a person who, they had a letter of recommendation, and the person who was writing it for them was a very well-known scientist, PT, had done a ton of great work, but it was very clear that the attention that that person gave to writing that letter was much lower than like the other letters. And I think even one of the comments they wrote in there was like, you know, this person was good in X, Y, and Z, and like they forgot to delete the X, Y, and Z and actually input the things that the person was good at. So like clearly that person just didn't spend that much time on their letter of recommendation, and that just looks bad. Yeah. So it's better to make sure that you have letters that are strong and intentional, even if they're not from the people that are like strongest, that you would think are the strongest in the field or would make the biggest impact. Ideally you would have both, but if you were to choose, make sure it's someone who's going to spend the time to be careful.
So you graduated PT school and now you're in Colorado getting your PhD. And what made you decide to stay in Colorado and get your PhD? And were you working at the same time, like in a PT clinic, or what was that kind of journey like?
Yeah, so when I finished PT school, the last year of PT school, I was trying to make some money because PT school in Colorado, particularly when you're out of state, is super expensive. Mm-hmm. And I started working in a lab, and the woman whose lab I was working in, after I finished, she was like, well, you know, you started with this project and it's actually turned into this great project. You should probably stay on and at least finish it. Mm-hmm. And I still had to take a few months because the boards weren't available. Like I think I graduated in May and I couldn't take boards till July. So I had a couple of months, and I was like, well, I might as well just stay on and work and finish this project. And they hired me on as a research assistant. And then I took boards, got a job in the clinic. I got a job at an outpatient orthopedic clinic that specialized in spine. Mm. And then I just continued working part-time mm-hmm. as a research assistant. And then after about 6 months of that, the woman that I was working for in research was like, well, you know, you're really doing what a PhD would do. So you might as well just apply and get a PhD, because right now you're getting paid for it, but you could be getting a degree for it. And I was like, no, I really don't want to do this. Like, I don't want to go to school again. It's going to be tricky because then I'm going back to school and I'm not making as much money as I could as a clinician and that type of a deal. But I kept doing it. And then finally she was like, Bahar, like either, you got to make a decision here, either do the PhD or like, it doesn't make any sense. So finally I was like, okay, I guess I'll do the PhD. I mean, she just sucked me in. I don't know how it happened. So then I had like a year where I was doing research as an RA, and then the whole time I was working also simultaneously in the clinic. And then I officially started as a PhD student a year later. And so it took me, 3.5 years to finish my PhD. PhDs typically, as you guys probably know, take a little bit longer, but because I had a head start from even when I was in PT school, I finished it in quite a shorter amount of time. And the whole time I was working, so I worked in the clinic for 7 years because that was pretty much the duration of time over the course of like finishing PT school, having that little like gap year where I was doing research, but also in the clinic, and then starting my PhD and then finishing my PhD and then waiting to transition into a postdoc. That whole time I was practicing. So that was kind of the way that I was able to incorporate both things. And the PhD program was very gracious in allowing me to do that, because normally you're not really allowed to practice while you're doing a PhD at the same time. So my program was pretty much like, well, as long as you're getting your work done, which they were very protective of making sure that I met my benchmarks. They were like, as long as you're getting your work done, you can still, we don't care what you do on the side. But I was like 3 days a week in the clinic, so it wasn't really on the side. It was, but I mean, I just worked my ass off, and that was how it happened.
So what was your PhD, like what were you studying? What was a PhD is a thesis, correct?
Yeah, so a dissertation.
A dissertation, okay.
My dissertation was on the transition between acute and chronic pain in people who were developing neck pain, essentially. So I studied pain processing mechanisms, so how the brain and the spinal cord adapt to develop pathways that end up in a chronic pain phenotype. And the particular population that I was looking at was office workers who developed chronic neck pain. So that was kind of, and I did a lot of, as a part of that, I was looking at a lot of risk factors that involved motor control. So movement patterns, I did a lot of EMG type studies where we were measuring muscle activation patterns and posture, and also all of these neurophysiological measures that kind of look at people's pain tolerance and pain perception. And there was a lot of psychology there. We did like psychological manipulations where we would play good cop, bad cop to stress people out and see if it changed their pain patterns. I mean, it spanned a lot of different disciplines actually, which was very cool. And it prepped me for a lot of different types of research moving forward. And throughout all that, I didn't have to get back on a bench.
But do you think your PhD informed your practice at all?
Absolutely, 100%. Yeah,
using like what you were learning in the lab, like in the clinic, like right then and there.
Yeah, I mean, I think that was one of the biggest draws to doing the PhD and why I actually decided to end up doing it, because I was in this really great position where I was in the clinic. I had questions in the clinic that I couldn't answer. I could go to the lab and try to answer them. Some of those things are easy to answer quickly, and some of those things take a long time to answer. I would find out some portion of the answer or all of the answer, take it back to the clinic. And at the time I was also, I mean, as part of the PhD, I had teaching requirements too. So I was teaching in the PT school as well. Oh, wow. So I had this like nice circle where I was in the clinic practicing, learning how to answer questions that I had about clinical questions, and then teaching it, and then being able to apply it back in the clinic. So it was like this perfect rewarding circle of being able to apply all of the areas of knowledge that you might ever want. It was great.
So sort of having all that knowledge, were you able to like address gaps in the physical therapy kind of curriculum and say like we need to figure this out, or like we need to study this more?
Yeah, I think so. I mean, I actually developed a seminar series as part of our neuroscience track to specifically teach about chronic pain mechanisms and treatment strategies associated with how to deal with that, because I think it was like a very new field at the time. Now it's gotten a lot farther, but it was very new and people just weren't thinking like that at the time. So it was really nice to be able to actually incorporate that as part of a formal educational piece back into their curriculum. And that has since stayed in their curriculum. I don't know who's teaching it now, but
hopefully they're doing it right.
I'm sure they are. I see a question about the transition between Colorado and California practice in that chat. Yeah. In terms of that, that's super easy. I mean, board exams are national, so you don't have to do anything with that. That's like any board exam. But for certain states, because the laws are different, it's actually kind of like law. You have to take a jurisprudence exam to practice in certain states where the laws might be more or less stringent. And California is definitely one of those states where the laws are extremely complicated about what you can and can't do in your scope of practice. And it's probably one of the more restricted states for scope of practice and for a PT. There are I could do a lot more things in Colorado as a PT than I can here in California. Not in a way that's, I think, super limiting, but it's just kind of annoying. So I had to take a jurisprudence exam and go through like fingerprinting and that kind of a deal. But other than that, that was pretty much it. A little bit of paperwork and the test.
So you finished your PhD and then you came to UCSD to do a postdoc. Did you continue to do physical therapy and like work in clinics?
No, I mean, when I came to do my postdoc, it was not as flexible as my PhD, where there was a lot of time or options to work multiple days a week in the clinic while trying to do a fellowship. I mean, it was meant to be intensive, and my goal was to learn a lot in a very short period of time. And my postdoc was back to the bench. So I was doing things, as you know, Brad, that involve that do involve a little bit of pipetting and involve some bench work. And that had been a very long time since I had done any of that. And it was a very different way of thinking than I had been spending over the last decade prior. So it was a steep learning curve. And I don't think that I had made kind of a decision to focus most of my time on optimizing that learning experience, because postdocs are typically, they're short. They're a couple of years max. And I didn't want to spend a ton of time in a postdoc position where I just wanted to optimize my time. So I didn't practice during that time, even though I probably could have, like on the weekends or PRN or something like that.
So did you ever like go back to physical therapy after that, or like do you miss it compared to bench work?
Yeah, I mean, first of all, I mean, the good thing about now is I don't consider myself back to bench work at the moment. There's a lot of stuff that I get to do that incorporates a lot of the different components of what I learned in my PhD and in the clinic and in the wet lab. So I have a basic science arm to my research. I have advanced imaging and quantitative sensory testing and pain processing projects that I do. And then there's a clinical component where I am in the clinics with patients. I'm not necessarily treating, but I'm in the PT clinics with patients and measuring outcomes and trying to modify treatments to optimize those outcomes. And then even sometimes in the OR with surgical patients and trying to like figure out what's going on. That's a little bit attached to the basic science because we do biopsy type studies, but the exposure there is pretty broad, and the application of that science is also pretty broad. So although I'm not in practice at the moment, I'm still exposed to patients in a way that still makes it satisfying to me. But I do miss like the traditional practice model for sure.
Do you ever think you're gonna go back to practicing? Because at some point in here, you kind of made the decision to stick with research. I'm gonna say.
I would like to. I think that there is probably, I have to find the right avenue for it, because right now UCSD, I mean, one of the reasons that I haven't up to this point is that UCSD's model, I mean, UCSD doesn't have a PT school, and UCSD's model is, and the PT department is an entirely, I mean, I'm in the, and it's a separate department from PR, which is where PT is housed at UCSD. So in order to be able to work, there's some logistics issues there that I've been trying to figure out how how and when the best strategies are to be able to incorporate those things in a way that doesn't make it more trouble than it's worth. So I think it's just a matter of timing and strategy.
Yeah, it's a process, especially with PTSD. We figured out. So around 2017, you ended up writing a grant and studying the 3D quantification of exercise-induced recruitment in pathological paraspinal muscles. Where did this interest come from? You were the principal investigator, and like, what was that like?
The postdoc at USD, I started working primarily on basic science types of applications to muscle physiology and looking at the changes in back muscle health in people who had low back pain, essentially. And the biology part of it was the strength of the lab that I was coming into as a postdoc. And there was also an imaging component. So there was some MRI work being done at the time in that lab. And that work was fairly well developed, but also not necessarily being applied in the way that that project could have used it to be applied. And so that was kind of the impetus for writing that grant. I actually was like sitting on a train. I had done this, I'd gone to Switzerland to do like a visiting postdoc.
Balgris, right?
And in Switzerland, the University of Balgris, that's where I had gone to do that. Their chair is a spine surgeon, and he had a lot of questions, and they had some really good imaging people there that are very well known in the area of spine for imaging. And so I like distinctly remember sitting on a train and like having a conversation about this idea and then coming home and writing the grant. Or actually, I don't even think I had come home and wrote the grant. I literally wrote the specific aims page while I was in Switzerland and sent it to the program officer at the NIH. And I was like, is this a cool idea? And they were like, yeah, sure, submit it.
Wow. So what exactly, because I think there's kind of a lot of ambiguity about what a principal investigator is, especially like in the pre-med community. You always hear other people talking about like my PI or like my PI, blah, blah, blah.
Yeah.
What exactly is a principal investigator?
The person who gets the money.
The person who gets the money. So they're the one that's in charge of that specific research project.
Yeah, I mean, the way that grants are kind of structured, it's pretty much the way that it works is whoever submits the grant is the person who theoretically is the person who generated the majority of the idea and is submitting it under their name as like, this is my idea and I am going to ask for money for this idea. Mm-hmm. Just like any other project, you're never in isolation. It's never only my idea. It's never, I'm the only person who ever thought of this in life. Like there are a bunch of people there. It takes a village to put all this stuff together. And so oftentimes the PI is given a lot of the credit for that, but it's actually like there are these, I mean, science is collaborative these days, right? So you have co-investigators and you have MPIs, which are multiple PI grants where you share PI-ship across 3 or 4 people or however many people it takes to complete an idea. And sometimes that makes sense because you have one person who's like, well, I'm an imaging expert. And then you have another person who's like, well, I'm a psychology expert. And you have a third person who's like, well, I'm a surgeon. And all those 3 people need to contribute their expertise and their skills to be able to generate the overarching idea for a grant. And so that's based on those types of scenarios, the PI decision is made, but ultimately the named PI is the person who gets the funding and allocates or decides how to use the money for the grant.
It's interesting. I never knew that.
There's a whole business side of this that like nobody taught me.
Yeah. No one tells you that in pre-med.
No.
So flash forward to today, and I think you have something like 15 papers that have been published. How many do you have in the works currently? Just kind of an ambiguous question. And then do you feel like your papers have all kind of built off of each other, or are they all like standalone in some way, or like is there some question behind all of the papers that you're kind of trying to answer?
So to answer your first question, how many? I don't actually know. I feel like I have a bunch of stuff that's like in progress right now. And that's how things go. It's like you go in phases where 1 year, and I don't know, I mean, sometimes you can find on Google Scholar or whatever, where it shows you like how many publications a year you have or whatnot. And I think particularly because I'm kind of like a younger investigator, that line is a little bit more obvious, but you can see like it's super like phasic. Sometimes you'll be working on a project and you're not publishing that much about the project because it takes a while to get your results and analyze them and get them together. And then all of a sudden you'll have this like year where you have 4 or 5 papers in a year, and then you won't have anything the next year. And it's just like all over the place. So, so I think that I don't really have a good sense for where I'm at in any of those like distinct project phases, with the exception of like, I mean, progress. You just have to know that you're moving forward, right?
Yeah.
The expectation when you're a PhD student is you have to publish a paper a year. It's maybe like 1 or 2. You are, you're learning a new skill, so it takes a little bit longer to get that ramped up. And then once you're a faculty, then the expectation starts to increase. You should be publishing 3 or 4, and then that should be kind of like a consistent upward trajectory as you continue to advance in your promotions and whatnot. So that's kind of the standard for like expectation in terms of publications there. In terms of like idea pathways for publications and whether there's underlying questions and how that all works, I would say I have an umbrella theme, which is spine. That's a super broad umbrella theme. When I had a very kind of discrete pathway of publication that had to do with neurophysiology of chronic pain in spine during my PhD. And then one of the points of doing a fellowship is you want to do something completely different and learn a very different set of skills than what you learned in your PhD. So by nature, you kind of have to switch gears and not follow your trajectory, because otherwise, why would you do a postdoc? You're not learning any new skills. You would just go straight to a faculty position and do what it is that you learned. And a lot of people actually do that. It's just harder to get grant funding that way if you don't have a fellowship, because it basically shows that you're unidimensional. Not that that's a terrible thing. It just means that some people will stick with their thing and they just take it all the way. But the postdoc is specifically designed to broaden your skill set. So you'll see a lot of people have a very discrete set of papers in their PhD, and then once they move forward from a postdoc on, then that shifts quite dramatically. And then they'll have like from there on out, it should all be connected pretty much. And so I would say that my publication record follows fairly well that kind of model. Although I'm trying to kind of circle back and find more like, here's my PhD work and here's my postdoc work. And now I'm kind of trying to make it all meet in the middle and then take that into a publication career trajectory set of questions that is long-term. Because if you're just answering little questions here and there, that number one, doesn't give you longevity from a funding perspective, because the NIH wants big questions. They want big scope. They want long-term impact, and they want a 10-year trajectory. They want to be able to see that in your grants. So if you don't have that in your vision, then they're not going to give you money for it, because they want you to have a career based on their investment. So I would say that that's kind of the goal, is to make sure that you do have an umbrella topic that you are able to, I mean, you can branch out a little bit here and there, but you should have a very clear vision that is visible in your publication record.
So out of all the papers that you do have that you remember publishing, what was your most favorite, or like your most exciting to like research and write about, and or perhaps like which one do you think has made the most impact?
Oh, those are two very different questions.
Yeah.
I have two papers that I really like, and I don't have a good sense. Impact is a hard question for me to answer because I'm biased, and of course, I think that the stuff I do is super cool and should have like a impact. So it's a really hard question for me to answer about impact. I would say the most enjoyable for me to write and the most rewarding, or the most enjoyable and most rewarding was the paper that came out of my thesis or my dissertation, which was on psychological, neurophysiological, and physical risk factors for developing neck pain. That was super rewarding for obvious reasons. I mean, I had spent a ton of time working on that paper. I had collected data on 200 some people just for like one portion of that. I think it ended up being more like 500 people total if you just add up. Like, it was a ton of work. And so getting that out there was a really, it was like a personally rewarding experience. Scientifically and all that, I also think it was a good product. Of course, I'm biased on that, but it was just like, you know, out there, and that's my baby. The other paper that I really like, and I think impact is again yet to be determined because it's brand new, is a paper that I just recently got published on like the cells involved in muscle degeneration in people that have spine disease. And that one was also a paper that was about 3 years in the making, because we kept trying these things, and it was one of those, like, I'm exaggerating here, but it was one of those like penicillin discoveries. It was an accidental thing where, like, I looked at it, we were looking at a bunch of just histology of muscle in people who we had spine biopsies from, and we were like, well, what's that? Like that I've never seen that before. That's kind of a strange thing. And we just chased it. And it was not something we were expecting to see. It wasn't a hypothesis. It was something that popped up, and we chased it for 3 years, and this paper finally came out of it. So I would say the coolest papers or the most enjoyable papers for me to write are the ones that have been the hardest to get the result out, and they're also the most rewarding because they've taken so much effort.
Yeah. So what are you currently researching?
So I have 3. Brad, you should be able to answer this question a little bit. So I have three branches of research that I'm focusing on. One of them is looking at the molecular mechanisms for muscle degeneration, which essentially means in people who have low back pain or spinal pathology, their muscles kind of start to degrade, and their muscles degrade in a very specific pattern. And we're trying to understand what the cellular mechanisms are underlying that pattern. So that's one of the areas of research that I'm looking at, that Brad's also looking at in detail. Another area of research is, as I mentioned, I think before, the advanced imaging component, which is trying to use, because the molecular and cell biology is invasive. You have to get tissue from somebody, and that is not easy. I mean, you try to convince someone that you want to take a chunk out of their spine while they're getting surgery, and sometimes it's not the easiest thing to do. Even in the name of science, people are a little bit wary of that. So advanced imaging is an opportunity to be able to look at some of the same features, but using fancy MRI physics and tools and MRIs and things like that allow us to look at things in a lot of detail that we otherwise wouldn't have been able to do without being very invasive. So that's another avenue that I'm looking at, is developing imaging tools that allow us to understand biology of muscle health in detail. And then the third arm of research is very clinical, where I'm looking at specifically the clinical outcomes for different types of exercise interventions along the rehabilitation, the course of rehabilitation in people who are either getting managed conservatively for low back pain or have had surgery and are recovering from surgery. So trying to optimize, like, what are the exercise doses? What kind of range of motion do we want to put them in? Is there a certain subpopulation of patients that does better with this type of exercise versus that type of exercise, or no exercise? Those types of things are larger, more population-based studies that deal with electronic medical records and pulling data from clinics around town that basically implement these practices on a daily basis.
Yeah, it's a lot of stuff. It's mostly geared towards lower back pain at this point.
Yes, yes.
Yeah.
Yeah. Oh, yeah. And then there's I keep forgetting. There's also. I mean, I kind of lump this in with the advanced imaging part, but there's a branch of research where, you know, I had mentioned that I'm trying to kind of meet my two worlds of pain, chronic pain, and this kind of muscle physiology world together. And one of the places that we're applying that is in looking at brain activity and the correlation between brain activity and muscle health and spine health in vets who have undergone traumatic brain injury that have post-traumatic headache. Because a lot of times those people have neck injuries that are not appropriately diagnosed, because the TBI, or the traumatic brain injury, gets kind of put at the forefront of treatment, and they're managed like pharmacologically, but they're not really considered to have another injury outside of the brain. So that's another project it's an example of bringing those two worlds together, where we're doing a bunch of pain testing and brain function, and then also looking at these biological and imaging-based measures of the spine.
Really to understand all the underlying like mechanisms and stuff that go into back pain and
exactly
pain injury and all that.
Spine pain in general, yeah.
Yeah.
I have a question from somebody. This is kind of jumping back to the topic of physical therapy, but do you have any advice for people listening who are aiming to go on to PT school? Like, just kind of a sign, I guess, that they're going on the right path?
That's a question. I think in order to understand if you are a match for PT, I think that there are a couple of things that I would definitely recommend. One of them is, of course, something that you would already have to do if you were applying for PT school, and that's getting into a clinic and volunteering and exposing yourself to not just a single setting, but all sorts of different settings. I think a lot of people expose themselves to what they think is PT, and that primarily manifests itself in outpatient orthopedics. That's the most common setting that people associate with PT, but PT does burns, they do inpatient, they do neuro, they do peds. I mean, there's so much stuff that physical therapy encompasses that a lot of people don't even know. So I think that getting into a variety of clinical settings will help people make that decision. And secondarily, I would have a very good understanding of the financial implications of that particular career choice. I think that PTs in general, just like many allied health professionals, are underpaid for the knowledge that they're expected to learn and the education they're expected to pay for. So that becomes disillusioning if you don't know that already. So just make sure you know what you're getting into, because if you think that you're getting a doctorate and you should be paid like a doctorate, that's not going to happen. So I think that understanding what, like, you can look that stuff up super easily, like what are the average pay rates for any given geographical location and setting and whatnot. And so understanding that what the pros and cons to that are, and accepting that, I think are important things to make a decision about whether that works for you.
Mm-hmm.
So just a few final questions. because I know that we're coming up. You have a class at 6, right?
Mhm.
So, so this is just kind of a broad takeaway. So you're a trained physical therapist and a spine researcher. And I think right now, more than ever, your expertise comes in handy because of how much people are sitting at home. Does prolonged sitting have negative effects on posture, spine health, or back pain? Or, what advice do you have for people at home to mitigate those effects?
Yeah, so I mean, the short answer is variety. There is actually no data that supports that poor posture is a risk factor for developing pain. In fact, there are plenty of people that have really awful posture that never develop pain, and that's just a thing. And so that's why I say variety, because I think there's been a lot of, particularly like in the 90s, there was a lot of stuff on ergonomics and what are the exact angles that you have to sit at your desk to make sure that you're decreasing stress and whatnot. And all that has pretty much been debunked. The only place where that becomes a significant, risk factor is if you're like a mechanic and you're working in awkward positions. I would not consider sitting at a computer an awkward position. So in terms of like postural risk factors and those types of things to try to make sure that you're not putting yourself at additional risk, it's not all that complicated. Just move around every once in a while, but you don't have to worry about like, I have to, have this angle and look straight ahead and make sure that my neck is exactly right and my shoulders are all even and everything. Like that doesn't really matter.
That's very
And also don't stress yourself out. If you're stressed out, you're going to have pain and it has nothing to do with musculoskeletal issues. It has everything to do with the fact that you're overly stressed out and your physiology responds to that. So, I mean, a lot of that is just common sense. And this is another frustrating thing about PT is that like you are overeducated to administer common sense strategies to people.
So I think the big takeaway is just kind of stay moving.
Yeah.
Stay moving and de-stress any way that you can.
Yeah,
what do you normally do to stay healthy?
Yeah. And don't think too hard about trying to be perfect. Like if you're, I have treated so many people that they come into my office and they're like, but I do everything perfectly. Like I sit exactly like this and I don't move. And I'm like, but that's your problem. Like you're perfect, but you don't move. And so your perfect muscles that are working to keep you in that perfect position are overworking. And so you, no matter what you're doing, you're kind of at a loss. So that's kind of one of those things where you just like every other thing that health condition that pops up, the best answer is always to mix things up and everything in moderation, and exercise is good. And yeah. I mean, that's why we're on this on
big takeaway.
Call, right? Yeah.
We really like exercise. Do you have any, from the PT side of things, do you have any advice for people who might have back pain and it's becoming like worse, or like from just being at home and not being able to I don't know, get out and move? Like, are there exercises or stretches that people can do at home to help alleviate that?
Well, I think that probably depends on sources of back pain. One of the hard things about back pain is it's really tricky to figure out what actual like anatomical pain generator is, meaning what structure might be causing you pain in the back, because it can be muscle, it can be disc, it can be joints, it can be all sorts of things, and other areas aren't necessarily that complicated, which is why spine is so cool. But generally speaking, if your aerobic activity is probably one of the best preventative measures, even though it's not like a back specific type of exercise, because the back is primarily made up of stabilizing muscles. Aerobic exercise is a good way to make sure that you're keeping those muscles from getting overworked. And they're going to work anyway, but they're not going to be like overworked in any given area. If you, that advice changes if you end up having a very specific injury, and this is kind of doing, if you have, a certain injury like a disc herniation, I might choose to do a certain type of strengthening or stretching. Whereas if you have stenosis or something that is more neurogenic in nature. We have a nerve injury, a nerve pinch, I might choose to do something else. So the recommendations for what stretches or exercise or types of things to do vary a lot depending on what we think the source of tissue injury or pain is.
Well, very cool. Thank you for coming on. Do you have any final thoughts or comments to our listeners? Anybody out
Well,
there?
I mean, other than my
our
plug
platform.
for exercise is medicine already, right? Like, does that feel like good? I mean, as a PT, I feel like I'm obligated to say that, but you guys already say it for me, so I don't really have to do it. Just make sure you stay moving. And I'm also happy to answer any questions. I know that if there are people that are interested in the PT school route and they have more specific questions about, what the application process is like and how to optimize your applications and whatnot. Like I've done that for quite a few years, and I can give a lot of tips and advice if that's helpful for people. So I'm happy to have people contact me individually if they have questions about those types of things as well.
Yeah, maybe sometime in the future we can have you back on just to talk like specifically about
Sure.
how to get into PT school or
something.
Yeah. Well, yeah. So thank you so much for coming on. I know that you have an incredibly busy schedule, and I know that we and all of our listeners really appreciate your time, and it was a pleasure.
Thanks.
Thank you.
Hope you have a great day.
You
Thank
too.
You. Yay. Okay, also.
Oh yeah, and our outro. We're still live. Thank you for keeping us on, Alan. So be sure to check out the past video podcasts available on our YouTube channel, Exercise Medicine at UCSD. And check out our socials, EIM.UCSD on Instagram and EIM at UCSD on Facebook. We are also starting a fundraiser to raise donations for the WHO COVID Relief Fund. So go check it out on our social media. And lastly, please subscribe to our newsletter. The link is in our Facebook page and will be in the description of the video below. It's a free and fun weekly read for anything from common injuries to interesting exercises to healthy recipes to go for the week. And just one last plug, our podcast, this podcast just recently got into Apple Podcast. So you can go and subscribe and listen to just the audio if you'd like. It's under Exercises Medicine at UCSD. So we will see you guys next week. Thank you for listening.